Let's talk about the increasing use of drugs in the schools, colleges, and universities of Pakistan. Nearly 500,000 people are being added to the drug addict list every year in Pakistan, and out of these, most are between the ages of 18 to 25 years. One in every 10 university students is using drugs. And in general, about 6% of our population, that is about 6.7 million people, are using drugs, which accounts to around 9% of the adult males and 2.9% of the adult females. So, what is this drug addiction? Why do people fall into the habit? What are the effects that it produces that people get addicted to it? How do you recognize those signs and symptoms, and what you can do about it? This is all that we are going to talk about. I'm Dr. Mariam Atiq. Now, drug addiction is a complicated neurobiological disorder in which there are actual changes in the brain and in the behavior of a person, which makes them unable to stop the urge to use the drugs. It is a trap, it is a whirlpool, and once you step into it, there is no way out. It is very, very difficult. You just start getting sucked in deeper and deeper. What usually starts as a new experimentation soon becomes a dependence. So, what is it that makes people start using these drugs? Number one, Pakistan is flourishing in illegal drug trade, and we are earning nearly $2 billion of revenue every year by this. So there is very easy availability on the streets of all the different kinds of drugs, and they are not even too costly, so people can get easy access to them. Then there are family issues, people from broken homes, single parents, lots of poverty, or even lots of money at home. Then toxic relationships in which there is a breakup or fights between spouses, between siblings, and to seek solace, people start using drugs. Then there is study pressure. The stress makes them start using the drugs. Then there are mental illnesses like anxiety, depression, post-traumatic stress disorders. And then there is a genetic makeup also. People who are having fathers and forefathers using different kinds of drugs, they fall prey to it more. They start getting more pleasure than the others with not the same genetic makeup, and they can easily fall into the trap. Now, which are the drug addictive substances that are easily available and are being used in the schools and colleges and universities? They are normally the cigarettes, alcohol, and then there is shisha, which is the hookah or the water pipe. Then there is marijuana, there is cannabis, there are the different kinds of opioids, which are normally given for different therapeutic purposes for chronic pains and illnesses, but people get hooked onto them, like Vicodin and Oxycontin, etc. Then there are sedatives given for anxiety and depression like Valium and Xanax. Then there are stimulants like Adderall, like Ritalin. They also cause addiction if used beyond the prescribed medication. Then there are the ice, crystal meth, glass, methamphetamine, whatever you call by different names, it is the same thing, and it produces the high effects for nearly 6 to 12 hours. So this is very commonly used because the effects last longer. Then alcohol is always there, running in the background, easily available, and people fall prey to it. Now, what are the effects that these produce that people fall prey to them? Initially, when they are used, they start making you feel happy. There is a sense of euphoria. There is a feeling that there is no stress, there are no worries, and you are elated, you are on cloud nine, you are flying in the air, and you are feeling like God, you are feeling experiences, you are having hallucinations, and you feel that the world is like a heaven. Then there is increased concentration, there is increased alertness, there is easy feeling that you can learn more, you are stimulated more, you are performing better This is one of the reasons that the students fall prey to it. Then there are reasons like, especially for the ladies, that it makes you lose appetite and therefore you start losing weight. And most of the ladies want to do that, so they fall easy prey to it. But this is only initially. Soon, the same amount of drug does not produce the same effect, and this is when addiction starts, and you need to keep on increasing the dose to get the same feeling. If you stop taking the drug or you don't increase the drug, then you start feeling negative symptoms and you start having negative signs, and this is where we need to start taking care that we are addicted and we need help. Now, what are those signs and symptoms? You will people notice with drowsiness, with lack of proper speech, lack of proper coordination, irritability, mood swings, inability to concentrate, inability to make judgments. Then the motor skills, there are shaking in the hands, there's involuntary movements in the eyes, the breathing is shallow, you're losing weight, your heart rate is increased, your BP is increased, your temperature is elevated, and you start feeling depressed, you start feeling lonely, you do not want to mix up with people, you want to be left all alone and isolated. Then the behavior becomes rude, you cannot control yourself, you do not know what is right and what is wrong. Some people start undressing in public. So all these symptoms point out that you are using some or the other form of drugs. And if you have a strong family binding, if you have good friends, if you have got good teachers, then they will start noticing the symptoms, and this is when you need help. Now, how can you help out these people? First of all, there has to be education to all the groups of people so they realize what is the side effect and what are the bad effects of using drugs on the long term, and they need to be aware of it. Then we have to remove those circumstances in which they are falling prey to it. There have to be group discussions where people can come out and talk about their problems. There have to be psychological sessions. There have to be group therapies in which all the parties involved have to sit together and talk out their differences. Then some of them who are into more severe form of addiction will need to get enrolled in the rehabilitation centers where they will be required to take medicines. They need to be under observation with the doctors, with their drug therapists, and they may need the treatment for a few weeks to few months. But unless you remove the triggering factors, then people can fall prey into it again. And in the long term, if you keep on using these drugs, this will have severe physical medical problems also, like they can be hepatitis, they can be liver cirrhosis, they can be peptic ulcers, they can be gastric ulcers, then they can be kidney problems, they can be different kinds of cancers. So please beware, share the information, make everyone aware, know about the harmful side effects, and do not fall prey to drug addiction, thinking of it as a fashionable thing to do, as something the peers usually fall into it when they want to impress their other class fellows, or they want to fit into a certain circle, or they want to impress some girls. So please don't fall prey to it, and stay safe and healthy and spread the education. Assalamu alaikum and have a very nice day.